Afternoon, so we'll be discussing the 12 lead EKG and of course the electrode placing. So when we say electrocardiogram or ECG or EKG, it is a test that records electrical activity of your heart through small electrode patches that attaches to the skin of your chest, arms, legs, and even with your lower back. And is also used to check for signs of heart disease. In doing this procedure, the physician will be able to check your heart rhythm. Then he will be able to see if you have a poor blood flow to your heart muscle. So meaning there is the possibility that the patient will develop ischemia because of blood circulation. And the physician will also diagnose a heart attack if that would happen. Then we will be able also to check on things that are abnormal, such as thickened heart muscle. And the physician will be able also to detect if there are significant electrolyte abnormalities, such as high potassium or high or low calcium. Actually, dun sa ECG tracing mismo, dun niya makikita yun. Okay, so what are the materials that will be needed or that you need to prepare? Of course, we need to prepare for the electrodes. So, alcohol prep or the alcohol swab. So, if in case that ang ginagamit mo naman is yung meron ng pagget na mismo yung electrodes niya, there's no need for you to use the KY jelly. But, there are times kasi na natatanggal talaga yung pagkapagkit ng electrode. So, much better if you will still prepare for a KY jelly. Then, of course, we need to prepare, of course, the ECG machine. And, dapat, ang kakatambal niya would be the ECG strip. Kasi hindi mo mamomonitor, hindi mo masyadong mapapakita dun sa doktor yung findings nung ginawa mong procedure if there would be no result na po pwede mong i-attach dun sa chart. Okay? Kasi there are some doctors naman talaga na during the procedure, wala talaga sila doon. So, you need to document the findings. Okay? So, what would be the procedure? So, you need to place the limb leans, the right and left arm, the right and left foot. So, the upper limb leads can be placed below the clavicle. Okay? So, this one is considered the upper limb leads. So, dito kayo po pwedeng maglagay ng upper limb. What about sa lower limbs? So, lower limb leads can be placed on the upper abdominal quadrant. Doon naman yung ating lower limb leads. Okay? Then, what about the placement of the chest leads from V1 to V6? So, please do remember this one. So, for V1, it should be placed on the fourth intercostal space. Of course, for the right sternum ka mag-start. So, V1, V2, then, yung V2 would be on the fourth intercostal space sa left sternum naman. Kung ang V1 nasa right sternum, the V2 should be on the left sternum. Dapat nasa fourth intercostal space. Then, the V5, the V4 pala should be placed on the fifth intercostal space in the mid-clavicular line. Okay? In the mid-clavicular, yung fifth intercostal space, yun yung V4. Now, what about the V5? The V5 should be level with V4. So, fifth intercostal space pa rin. But this time, instead of mid-clavicular, you'll be placing it on the left anterior mid-axillary line. Okay? So, anterior mid-axillary line should be the V5. Then, the V6 would be level with V5, but in mid-axillary line. Okay? So, yun lang. Please do remember the placement of the different electrodes in performing the ECG. Okay? Then later on, I'll be posting, of course, the video presentation wherein that would serve you as a guide in doing your return demonstration. Now, moving on with the next topic, the second topic would be the application of the transdermal medication patch. So, most of the time, the transdermal patch that we're placing on the patient is, of course, it's either fentanyl or the NTG patch. So, what would be the purpose of placing the transdermal patch? Of course, this one is used to treat pain, specifically the chest pain. and of course to deliver continuous amount of medication over a period of time. So what to watch out? Of course, you need to check for the respiratory status. So why? Because this might cause respiratory depression. Okay? Then check as well the blood pressure because this might cause hypotension. Then assess also for patient's pain rating. So 1 to 10 lang yon. So 0 means no pain. So up to 10 would be there should be pain. Pataas ng pataas yun. So, and of course, you need to indicate as well the location of the pain. Then, check for the fibroids. Okay, so what would be the fibroids that you need to check? Of course, we need to check for the right patient. So, when we say for the right patient, how are we going to check for it? So, you need to check for the ID band of the patient, and you need to ask for the patient's name, and of course, the birth date. Then, you need to check as well the right drug. So, how are we going to check for the right drug? So, you will be doing the counter checking from the doctor's order sheet, the card decks, the medication cards. Why is that so? Because from the doctor's order sheet, ita-transfer nyo yun sa card deck. And from the card deck, you will be transferring that one to the medication card. And the medication card, yun po yung dala-dala nyo sa bedside. Okay? So, those things should be checked. Okay? Then, right dose. Check for the right dose, the right time, and of course, the right route. Then, check of course the packaging as well. So, why do we need to check for the packaging? You need to check for the expiration date. Kasi sayang naman kung basta ka na yung nag-ticket, yun naman pala expired na yung gamot. Okay, so useless lang din siya. Another thing is, you need to check also for the damage or tampered material. So, if you think that one has already cut or opened, might as well return that one to the pharmacy. So, what would be the procedure in placing the NTG patch? Of course, you need to wash your hands, then don gloves to protect yourself from getting the residue from this patch. Then, gently remove the old patch. Then, how are you going to remove the old patch? Of course, you need to fold the sticky side together. Para at least, hindi nyo na mahahawakan, or considering that you're holding it with your bare hands, with your gloved hands, so, syempre, didikit siya kasi nga, may pagkit yung electrode. So, dapat half fold siya na parehas yung pagdidikitin yung sticky side. Okay? Then, dispose it properly. Then, clean the side with the damp cloth. Then, remove the residue. Okay? Then, open a new patch by tearing it and avoid cutting it with scissor para hindi nababawasan yung medication na nakalagay din sa patch. Then, place the patch on the other side. Make sure it's completely intact. No rash and no hair. If in case that the chest of the patient has a hair, so you need to trim but never shave. Kasi yung shaving kasi can lead also to infection. Okay? So, hindi advisable ang pag-shave. I-clip or iti-trim lang yon. Or medyo ihahawi mo lang siya at dun sa medyo part na walang hairy, hindi hairy, dun yung ilalagay yung electrodes. Then, practice site rotation. Okay? So, we have different site wherein you can place the NTG patch. Then, hold it firmly for 20 to 30 seconds to make sure that it's intact, in contact with the skin correctly. Then, doff gloves and wash hands. So, in some institution, the nurses, they're not just placing it firmly. Kasi nga natatanggal siya dahil medyo minsan nababasa yung skin ng pasyente. Nagda-dry din minsan, nawawala yung dikit ng patch niya. So, ang tendency, nilalagyan nila yung border ng tegaderm. Okay? Then, after that, doff gloves and wash hands. Then, do your documentation. So, what would be included in your documentation? Of course, your initials, kasi that one is considered a medication, and indicate as well the site, kung saan nyo ba nilagay yung NTG patch. Okay? So, as you can see from the picture, here are the site or the placement of the NTG patch. Okay? So, here from the picture, we have the left or right upper arm and the left or right side of the chest as well as the back and of course the left or right lower back. So, yan yung mga area kung saan nyo po pwedeng ilagay yung transdermal patch. So, that's it. So, thank you very much and hope to see you next week. Then, please be ready for our quiz at exactly 3 p.m. Thank you.